Hi, I'm Dr. Mike Milligan. We're here at the inaugural meeting of the American Academy for Oral Systemic Health, and one of the keynote speakers is with me right now, Dr. Brad Bale of the Bale-Donene method. Brad, thank you so much for being with me.
Well, thank you, Mike. Appreciate the interview.
Phenomenal information. And why don't you give me a little history about yourself, and then the fact that you can guarantee people under your care won't get a heart attack or a stroke, the major killers of all of us.
Right.
That's amazing to me. Tell me a little bit about yourself, what got you into this, and then what you do now. And I'm becoming a patient of the Bale-Donene group, and I mean, it's incredible what's going on here. So fill us in a little bit. Thank you so much for being with us.
Well, I went to medical school at University of Kentucky, graduated, then went to Spokane, Washington to set up my family practice.
Right.
And after being in practice for about 25 years, my oldest brother had a heart attack. A lot of my patients had heart attacks. Some of them had strokes.
Right.
And when I was a young child at 5, I saw my father's grandmother die suddenly from a heart attack.
Oh my goodness. Okay.
My mother's father died from a heart attack. My mother had a heart attack. She had to have bypass, ended up dying of heart failure. So I decided there must be something more we can do to keep people from suffering from these heart attacks and strokes. So simply started looking into it more. There was a doctor at that time, a cardiologist in Spokane, who was way ahead of his time, Dr. Paul Shields, who brought the technology of looking at the heart for calcification in the coronary arteries, electron beam tomography.
Right.
He had one of the very first machines ever manufactured for that.
Okay.
And I had already had my share of patients who I was concerned about. I sent them to the cardiologist. They would put them on a treadmill, tell them they're fine, and then some of them in a short time were in the hospital or dead from a heart attack.
Right, would have an event, okay.
So I knew that wasn't working. We didn't really have the science to tell us exactly why at that point in time, but the experience, observation told me, well, that doesn't necessarily tell you you're okay if you pass the treadmill.
Right.
So this Dr. Shields brings a coronary calcification test to Spokane, and I start using that and realize, well, if you have a positive score, it tells you you have disease there.
Right.
And if you have disease, there certainly is some risk of a heart attack.
It could progress right into that.
And I saw quickly, I was still using the treadmill some, I saw quickly how a lot of people would pass the treadmill, but yet they'd have the disease.
Right.
I said, and right at that time, they started theorizing it's really not the buildup of cholesterol that blocks flow of blood, it's a blood clot.
Right. And we just had Dr. Rudi here who found that information, one of the most famous cardiac surgeons in the world.
Yeah, and that's a funny story because he came to see me, he doesn't mind me telling this, and in our method, the first thing we do is educate patients on what we call event reality. The fact that it is a clot, it's not the cholesterol buildup. So Dr. Rudi comes to see me, and I don't care if they're a heart surgeon, a cardiologist, or lay public, I'm gonna go through the same thing. I've got to make sure.
Right.
So I've got Dr. Rudi sitting about where you are.
Oh my goodness.
I said, look, Lloyd, I said, I've got to cover this event reality, make sure you understand this. So I start into this about how it's a clot, and he said, my gosh, he said, you must not know the story. And I said, what story? He said, well, it was right over there, Sacred Heart Hospital, which was maybe 200 yards from where we were sitting.
Right.
Said at 2 o'clock in the morning, a 50-year-old guy having an acute heart attack, and the crazy cardiologist standing behind me saying, I know it's a clot, I know it's a clot. Lloyd, you got to pass the catheter.
Right.
Passed it, blow the balloon up and draw it back out. And he said, are you crazy?
I could kill this guy.
I might kill the guy, I'm not going to do that. And he said, I still don't know today why I did it, but he said, I did it. He said, I'm the one that pulled the clot out.
Right. He found it.
So he's the one that really proved it.
And prevention
I honestly did not know it. I knew the cardiologist he was the author on the study. I don't think Dr. Rudi actually, maybe he wasn't even listed in the publication that proved it, but Dr. Rudi is the one that pulled the clot out.
And so he's become
that's
a
amazing.
patient of yours and speaks
Well,
very
he's
highly as well.
Basically a patient of Amy's
Right,
now because I left.
The group, right.
Yeah.
Yeah.
So I left for Texas a year or two after that. But
so let's continue.
So so I started using this coronary calcification. This theory that maybe it's a clot started emerging and not the cholesterol buildup. And then I was one of a few providers in Spokane using this coronary calcification test along with an internist that I had a lot of respect for.
Okay.
So quite frankly, the cardiologists in Spokane, even in this Dr. Shields group, did not support him. And they started making fun of him.
Okay.
And then they started kind of making fun of me.
Right, right.
And then I realized that's the light bulb went off. I said, cardiologists aren't trained to prevent heart attacks.
Right.
They're trained to treat them.
Yeah.
And they're so busy putting out the fires,
So busy treating.
they haven't got time to prevent them.
Right.
And they're not trained in that.
Right.
So that's when I decided, wow, you know, nobody's really trained in how to prevent a heart attack. So I started researching peer-reviewed journals, gathering information, and utilizing it with real patients. I'm a family practice doctor, so a lot of my patients have been patients for over 2 decades. They were like friends.
Right.
And one of them had the coronary calcification test, and I repeated it like a year later, and his score had gone up quite a bit.
Right.
And by this time, actually, I was following them, and I wanted to get a repeat score. And by the time I wanted to get the repeat score, Dr. Shields basically had to sell the machine because nobody in Spokane would support it. It cost a lot of money, so he'd sold it to a doctor in Florida.
Okay.
So the nearest place to Spokane to get a repeat test happened to be Phoenix, Arizona.
My goodness.
The Arizona Heart Institute.
Right.
So I sent this patient, who's still a patient and a patient Amy's now, sent him to Arizona to get a repeat test.
Uh-huh.
And I'm in the room seeing another patient. And I get a page saying there's a Dr. Harvey Hecht on the phone for you. Well, I knew Harvey's name because he was big. He was one of the pioneers with coronary calcification. I said, Harvey Hecht? I said, yeah, I'll take the call. So I go out. He said, I've got your patient down here, and his score has gone up a significant amount in a relatively short time. So he said, I would recommend you send his blood to this brand new lab that just opened up in California. I said, oh, what's that? He said, the Berkeley Heart Lab. I said, oh, really? Well, Harvey, I said, you're an expert. I mean, if that's what you think we should do, go ahead and draw it and send it off. I'm sure he won't mind. And that's what opened the door to the Berkeley Heart Lab. They literally just opened, and I got that report back, and I looked at it and said, oh my gosh, the basic cholesterol doesn't tell you anything.
Right.
I mean, there's a quality to the cholesterol that you don't see on a basic cholesterol panel, and this really helps fine-tune how you need to manage somebody. So I started using the Berkeley Heart Lab, and then it was probably, I don't know, a year or two after that, Amy came on the scene. She wanted to do like a preceptorship for a nurse practitioner program. And wow, she was fantastic, and I could see immediately she was really into maintaining wellness and health. So then we formed, she joined me, and we fine-tuned the method that we call the Bale method. And over the years, it's about 3 years ago, we reached the point where we felt we could really guarantee our work. So we've been doing that for about 3 years. So
we guarantee your work. Tell me what that means.
It means if you're under our care and you suffer an atherothrombotic heart attack or stroke, and we make sure our patients understand that. That's where you have the disease in the wall, the surface over it breaks, you get a blood clot. That the fees you've paid to us would be refunded to you.
Wow,
and the patients understand that's not a malpractice guarantee. There's no malpractice connotations, but it's simply we believe medicine has advanced to the point where if you get the right information, provide the right treatment, you can shut down the disease of atherosclerosis in everybody.
Wow, that's incredible.
So it's like if you went to a good store to buy a nice suit and something happened to it, you'd expect the store to stand behind it. That's basically what our guarantee is. We'll stand behind our work.
For medicine, that's incredible.
And some people say, well, what if the patient doesn't follow your advice? Well, I think that's part of our failure then. If we didn't communicate through education with the patient why they need to do something to the point that it motivated them to do it, then we should accept part of the responsibility. That's our attitude about it.
But then you also monitor and you make sure that things are improving as you do the therapy.
Yeah, one of the secrets to making sure they don't have an event is to keep the artery cold, to not allow inflammation into the wall of the artery.
Right.
And when you see them, if it's inflamed, first thing you have to do is put the fire out.
Right.
You have to get rid of the inflammation in the artery, right. And then you don't ever want a fire to kindle up in the artery. It takes inflammation to trigger an event. You can be full of disease. As long as it never gets inflamed enough, you will not have a heart attack or stroke, and that's where the oral systemic link is so strong. As you know, when you have periodontal infection, that can cause enough systemic inflammation, and more particular inflammation in the wall of the artery, to actually trigger a heart attack or stroke.
Right.
So the work that oral healthcare providers do is essential in terms of cardiovascular prevention. I mean, if they weren't taking good care of the mouth, our guarantee wouldn't be
work.
very good.
Right.
So we have to make sure there's excellent oral health in order to make sure the artery never gets inflamed enough to
Right.
trigger a heart attack or stroke.
Right. As we close here, are there what would you say are a few keys in your treatment, diagnosis treatment, that we should take with us here? Just a few of the keys.
Yeah, one of the most important things to do is find out if you have disease in the wall of your artery.
And there are new technologies to help.
Yeah, you
do
can
that.
frequently do that with inexpensive, painless ultrasound tests.
Right. Non-invasive testing. In
Yeah.
fact, we even did some of that here at the meeting
Right.
here. And so technology has allowed us to do some testing non-invasively that tells us these things as far as the walls of the arteries and the inflammation, etc.
Because if you find you have disease, then you do have risk for a heart attack or stroke. What takes over for your immediate risk is how inflamed the artery is.
Right.
So then you need to do the tests that'll tell you that. They're simple, they're inexpensive. Some of them are urine tests even that don't cost very much at all.
Right. And then as far as therapy, certainly get your dental health under control.
Right.
Some of the other things briefly. Are there any medications that you recommend or other things that you recommend?
Yeah, if you have disease in the wall of the artery, the number one thing to prevent an event is lifestyle. And that's exercise, that's the right diet, trying to get your weight to an ideal weight.
Right. Good.
Reduce stress in your life, avoid anxiety, or if you have to have stress, make sure you've developed techniques to handle it well, make sure you get good sleep.
Very important, good sleep.
There's no medicine that can even come close to the risk reduction you can achieve with lifestyle. But when we find disease, again, we don't want it to get the artery to get inflamed enough to trigger an event. And you can argue very strongly from a scientific standpoint, the best medicine we have to reduce inflammation and keep inflammation out of the wall of the artery is a statin. So we do use a lot of statins, and we really don't care what the cholesterol is. We would argue statins are the best agent to ensure you have a non-inflamed artery, or if it is inflamed, to help put the fire out.
Great. So then, last thing, become a patient, or to learn about how we can help our patients as dentists get in touch with you. How do we get a hold of you?
Yeah, the best way is through our website, and that's baledonine.com, www.baledonin.com. www.baledonine.com.
Okay.
That's
And is there any last things that you'd like to tell us before we close?
No, I think it's exciting to see the leaders in dentistry, which we saw here today. They're the future of dentistry. Dentistry is going to follow the same path that medicine's proven it has to follow, and that's the maintenance of wellness, the maintenance of health. Right. We've already proven in medicine waiting for end-stage disease leads to bankruptcy. Our healthcare system is bankrupt now, and the three biggest reasons for that are end-stage disease, which results in the heart attacks, the strokes, and the diabetes.
Very expensive to treat once it's already there.
Right.
What happened? Much better to prevent.
Yeah, and dentistry's following suit, and these are the leaders for that we saw at the meeting this weekend. So we were very honored to be here, pleased to be here. It's exciting to be with a group of oral health care providers who are on the same page we are. Well, and that is, we don't really want to treat end-stage disease. We want to keep people healthy. We want to maintain wellness. That's what it's all about. So,
Dr. Bale,
excited about it.
Thank you so much for being with us here at the meeting. Thank you so much for being with us here on this video.
Well, thank you, Mike. Appreciate it.
It's been a pleasure.
Yeah, thanks.